Hi, I'm Mackenzie, and I did my presentation on multiple sclerosis, also known as MS. So, what is MS? It's a potentially disabling disease of the brain and spinal cord, where the body's immune system attacks its own tissues, which disrupts the flow of information between the brain and the body. So, specifically, something triggers the immune system to attack the brain and spinal cord, and it does this by destroying the substance that coats and protects nerve fibers called myelin. And when these whenever this protective coating is destroyed, the nerve fibers are exposed, and the messages traveling along those nerve fibers could be slowed or even blocked completely. So in this picture to the left, you can see this is a healthy neuron. And the signal can just travel, obviously, directly through it, but whenever that protective coating called myelin is destroyed, the signal is either slowed or blocked completely. So the cause of this is still unknown, but many scientists believe that it's a combination of environmental and genetic factors. So some of the signs and symptoms of MS, these are only the most common ones because there's such a wide range of symptoms for this disease. So first, we have fatigue, which is one of the most common and troublesome symptoms. It's often described as an overwhelming sense of exhaustion, making it a struggle to carry out even simple tasks. Next up, we have abnormal sensations, which is usually numbness and tingling in the lower extremities. Next is mobility problems, which this is usually connected to muscle spasms, stiffness, and weakness, and usually people experience dizziness or difficulty with balance and coordination. There's also pain, which takes two forms. Usually it's either stabbing in the face, like a stabbing pain in the face, or a variety of sensations in the trunk and limbs, like burning or pins and needles or even squeezing. Next up, so those are all kind of physical symptoms, but there's also cognitive symptoms as well. Cognitive dysfunction includes problems with thinking, learning, and planning. So this can include anything from a shortened attention span to getting stuck on certain words. It really covers a wide range of symptoms cognitively. There's also mental health issues, most commonly depression, but there's also been times when it has caused anxiety as well. But most commonly people get depression, which scientists don't know if it's actually a result of the MS or if that's just a result of living with the problems that they have to live with. There's also bladder problems, bowel problems, and issues with speech and swallowing, which are all pretty self-explanatory. Next up, we have the risk factors that contribute to developing this disease. First, your age. People who are 20 to 40 years old are more likely to develop this disease. Sex also, females are 2 to 3 times more likely to have relapsing, remitting MS, which is a specific type of MS that we'll talk about in a little bit. And the rest of them I split up into genetic and environmental factors. So first, we'll talk about the most recently discovered genetic factor called the HLA-DRB1 gene on chromosome 6. So this is actually something that I looked up in a peer review article, but this particular alleles of this gene appear to be the strongest genetic determinant for MS because they influence both predisposition and resistance to the disease. So different alleles of this gene could either make you more resistant to MS, but they could also, other alleles could actually make you more prone to getting it. So it just depends on the different type of allele, and this is still being researched, so they don't know a ton about it yet, but that's one of the That's one of the biggest genetic determinants. Next we have a first-degree relative. Next up, another big genetic factor is your family's history. So obviously, if somebody in your family got MS, you're going to have a higher risk of getting the disease as well. And last, we have your descent. So those of Northern European descent are actually at the highest risk, while Asian, African, and Native American descent are at the lowest, which will come back into play whenever we talk about climate and vitamin D. So next we have environmental factors. The biggest environmental factor is smoking. So I have in this picture up here some of the things that happens whenever you smoke. It interferes with your immunity, it increases your exposure or your risk to EBV, which is another environmental factor that we'll talk about later. And it also predisposes you to produce autoantibodies, which contribute to the development of the disease. So next we have climate. MS is more common in countries with temperate climates like Canada, the US, Australia, and Europe. So that kind of contributes to the next one as well, which is vitamin D. Lower levels of vitamin D are related to a higher risk of MS, which the two kind of go hand in hand because if you think about it, the temperate climates like the US and Canada, they typically have less sun. It's not as warm, so there's not as much sun. So the people there are probably going to get less vitamin D, while people who live in warmer climates are going to get more vitamin D. So we have Epstein-Barr virus, which is also known as EBV. So this infection causes infectious mononucleosis, which is otherwise known as mono, which is probably very familiar to us, or a disease that we all know of. So what happens with this is it potentially interacts with other genetic or environmental factors, which increases susceptibility and disease severity. So it can make you more susceptible to get MS, or it can make your disease more severe. Next up, we have the different types of MS. So first up is clinically isolated syndrome, which is not yet actually a type of MS, but it's the first episode of neurologic symptoms. So this first episode is a characteristic of MS, but it doesn't yet meet the criteria for a diagnosis because sometimes people who experience an episode might not ever actually develop MS. So the criteria for MS is actually 2 neurologic symptoms. So it can either be a specific finding on the brain that provides evidence of an earlier episode, or damage in a different location indicative of active inflammation in more than one region. So this is just before MS. It can help show that you might be developing MS. Next up we have relapsing remitting MS, which is the most common type of MS. It's by clearly defined attacks of new or increasing neurologic symptoms followed by periods of partial or full recovery. During remission, all of your symptoms may disappear, or maybe just some of them disappear, but there's no progression of the disease. Next up, we have secondary progressive MS, which is typically the type of MS that follows relapsing remitting. It's a progressive worsening of neurologic function over time, obviously following an initial relapsing remitting course. So it's more here. This one is more severe than relapsing remitting. And then last we have primary progressive MS, which is all by itself. Only 15% of MS patients have this type of MS. It's characterized by worsening neurologic function beginning at the onset of symptoms. So there's no relapses or remissions. It's just a constant progression. And in these you can kind of see in RRMS we have these relapses and then remissions. And then in SPMS we have a large relapse and remission phase at the beginning, and then it gradually worsens, and then PPMS just gradually worsens from the very beginning. So diagnosis and treatment. Following a medical history, since there is not a specific test that doctors can run for MS, a diagnosis relies on ruling out other conditions that could produce similar symptoms. So they have to, the first thing they do is obviously get a thorough medical history and examination, and then they would move to blood tests, spinal taps, an MRI, or evoked potential tests. Typically, they can find RRMS through an MRI, and since that's the most common, that's what they'll typically go for. In this picture down here, you can see the lesions that they'd see in an MRI, which would tell them that RRMS is present, or that's what is going on in that person. And then next we have treatment options. So there's actually no cure for MS, so they just have options that they can do to either speed recovery, slow progression, or manage symptoms. The first two options here are to help speed recovery. The first one, corticosteroids, reduce inflammation, and then plasma exchange is used if your symptoms don't respond to those steroids. Next we have slowing the progression of the disease, which these two products can be used to help reduce the relapse rate. And then last we have just managing symptoms, which is physical therapy can help you to strengthen your muscles and keep them moving, muscle relaxants, and then medications to reduce fatigue, which is one of the symptoms of MS. And then we just have our Works Cited page.